Well, first of all, I thank you very much for inviting me. I thank Denis very much for inviting me. He said too much and before, but so I spent the day today looking primarily at pediatric services and meeting the staff and meeting the senior managers and reading material that had been given before. And well, you know that Denis and I have an association. We were colleagues, but I think this institution is and this community is incredibly lucky to have a leader like that to lead this institution, to lead in the better organization, arrangement, evidence-based arrangement, and evidence-based management for the better use of resources and to the treatment of people that are sick or injured. But he does more than that, because I don't know of somebody else got lost.
Call extension 1774. Patty Virginia, please call extension 1774.
I have not seen a hospital CEO write in the annual report that he acknowledges and reminds everybody that 90% of human illness is a result of unfavorable physical or social environments, which of course is perfectly true. But most CEO concentrate on repair and not on acknowledging the causes for the reason for the repair. Of course, when you have a car or you buy a car, you're not interested so much as the fact that they have terrific repair places to repair it. You'd rather have a car that doesn't need to go there. And I think Denis recognizes that in the things that he initiates and leads in trying to prevent people from getting sick in the first place. This institution deserves to be better known and deserves a lot more respect than it gets in this community, I think, from what I've read in the papers recently. So I've been asked to do two things, to talk about the fact that children are not small adults, and to talk about neo-kids a bit, and then about the health of children, and therefore the health of society. Before I get to the second part, I just want you to think about one thing. What do you think is the most common health problem of children in this area? It might surprise you. I brought this tree because I don't think you'd confuse this with an adult tree. I mean, you can knock it over, as I just did. You can step on it, and if this was a hardwood tree, you'd have to protect it from mice girdling it at the bottom in the winter, and you'd have to protect it from deer eating it from the top. So once it got to be 25 years old, it'd be okay. It'd be an adult tree. The same for children. Child development is a rapid process, very active, and we don't really see much of it going on. In the first years of life in a child, new synapses are created in the brain at a rate of 2 million every minute, and that goes on for years. And it's easy to disturb if the physical and the social environment is not favorable for the peaceful process of this development. It takes up to age 25 for the forebrain to be sufficiently developed for the individual to be able to have control and to be able to have judgment. Insurance companies have known this for a long time, and that's why young people pay a higher rate of insurance until they're 25, because it is only after that age, more or less, that they're smart enough not to have accidents. So human beings take a long time to develop. They need a lot of help, they need a lot of support, they need to be in the right environment. During that time, we need to remember that we should do no harm to them, and that we have to assure the appropriate environment. We have to assure family needs, and we have to make sure that families can participate in satisfying the needs of their population. The hospital's neo-kids project is an important step in that direction to protect children and to protect the needs of children from other priorities that both society and the institution may have. When we were looking at creating the MUHC, we visited, before the merger, when I was still CEO and could dispose of budgets, we visited 36 institutions where a pediatric and an adult hospital had merged, and we interviewed 36, and we visited 4. We visited 4 because we visited 2 where the merger worked and 2 where it did not. So we tried to figure out why did it work and why did it not work. So we learned a number of things, and I'll just quickly mention 6 things and maybe a 7th, depending on your situation. The first thing that's important in a merger, and you're not a merger, but you have both services. And by the way, some of these things may not be necessary while you have Nicolas as a CEO, but one of these days, whether he wants to or not, he's going to retire, and you're going to have somebody else. And you want to make sure that if you don't get him again, that you get somebody that cannot destroy what has been created. So I think you need a separate, dedicated, and trained associate executive director to run the pediatric entity, or some such title. An administrative staff that is dedicated to the care of children, that is properly trained, nurses that are trained to look after children and that are not subject to bumping from other services when people lose positions or budget cuts take place, that you have the appropriate medical staff and the appropriate other professions. They are the ones that need to set the priorities, the needs, the schedules, and the rules of how the institution for children will run. I suggest that you set up something that we set up at the MUHC. We call it a Council for Services to Children and Adolescents. It's made up of professionals, it's made up of volunteers from the community. It supervises and looks after the care of children within the larger MUHC, as the Children's Hospital is part of it. And it is advisory to the board of directors of the MUHC. They need to listen to it. They cannot adopt any change or any rule or any different policy affecting children without the advice of the CSEA. And the CSEA participates in the recruitment of the chief executive and of the person that is going to be responsible for the children's services. I talked about a person that is, the next thing is a person that is responsible for managing the pediatric services. And this person should be the only one who speaks for children, should be joining the CEO in discussions with government or other government agencies, and should lead the strategic plan, and should be responsible for the budget of the children's entity. You don't have yet, but I encourage you to set up a foundation for children. They are very powerful entities. You will see that they will raise more money than all the other foundations combined. The Children's Hospital Foundation raised $105 million to contribute towards the $300 million that the government wanted us to contribute to the building of the MUHC. And the other foundations were supposed to raise as much but didn't. And now the Children's Foundation has been asked and has agreed to raise another $30 million, which it will do. So children are a good cause. If you do it right, you'll raise a lot of money. You'll also have a donor base that you can mobilize when the children's services are threatened. And that is an important element to consider as well. You have a community, you have a patient committee, or at the Children we call it Family Advisory Forum, and that's an important entity to help administration deal with family issues, children's issues, because they can contribute. They're credible, they've had the experience, they need to be listened to. But they also can help you in advancing the cause of children. If you have unfavorable experiences, as you I think recently had, they can be motivated and in large numbers. And although children don't vote, their parents do. We have a dedicated communications capacity for the children separate from the MUHC. because the issues are different, the approach is different. You use different kinds of media, beginning to use social media, which is very powerful, and also a good mobilizer if you need to mobilize anybody. If you have a research institute, which you have, in our case, we have an individual who is responsible for the research, pediatric research, but the rule also is that this individual is the deputy director of all research at the MUHC, replaces the head of research when this person is away, and is responsible solely for all aspects of pediatric research at the MUHC. So that we're part, but we're identifiable, we have our own mission, and we defend it. And we have structures in place to make sure that this defense works, that it can't be minimized or set aside because other priorities arise. So you may not need this now, but you need to make sure that you will not need it in the future either by setting up some kind of mechanisms like this or something similar that will fit into your community. The second thing I was going to talk about, I have to make, I don't know about time, right? How much time have I done? Have I done what, 10 minutes? Huh? The health of children. Our most important job in life really is to equip our children for life, to make sure we do no harm, and to consider them our most precious and essential natural resource. Of course, without children, there's nothing else. So we need to make sure that the children grow up healthy and that they become healthy and competent adults. This area, northeastern Ontario, is losing children, or here is losing children in Sudbury. You have lots more older people, and all these older people are much more sick than in the rest of Ontario. There's a shorter life expectancy, and it's really quite amazing how many years of life lost there are because of illness that really shouldn't be, because most of the illness that you see, whether it is orthopedic problems or cardiovascular disease, diabetes, mental illness, have their origins, cancer to even have their origins in childhood. And if you're sure that your children grow up normally, have the favorable development, you will reduce the number of sick children, sick adults in your community. The mandate of the regional authority, I'm told, or read in their business plan, is to make Ontario the healthiest place to grow up and to grow old. Well, so far it doesn't look like that. They say that number one priority is to keep the population healthy, and yet I don't see any plan or any activity to safeguard the development of children. We have to remember that we don't find health in the doctor's office or in the hospital. We go there for repair. We find health, or we lose it, where we live, where we work, how we live and how we work, and how we grow up. So nothing in the regional authority's business plan speaks to this, and I think that's quite worrisome, because the focus seems to be too narrow on process and not on what the larger purpose really is. And they forget, as I repeat, that the origin of sickness in adults is in childhood. So you look at this health statistics for adults in this area, you know that this is not a healthy place for children to grow up, and you wonder, and maybe should consider, why there is a decreasing number of children in the population. So children don't seem to count, and there are 113,000 roughly children in the area, and they are ignored. So that's 20% of the populations. So these are citizens that are silenced, they don't count, they're not in the budget, they're not in the plan, and most of the money, or all of the money, seems to go for repair. That doesn't seem to me to be a very promising future. I suggested you might think about what is the most common health problem for children in this area. And I'm not going to ask you what you think it is, because I doubt that very many of you would think of it, but it's the sexual abuse of children. In this area of the 113,000 population, almost 40,000 children will have been sexually abused by the time they're 18. There is no program of finding these children, identifying them, and then there's no large-scale or effective treatment program. These children are damaged for a very long.
Cancel code yellow, South Tower level 6. Cancel code yellow, cancel code yellow.
That's good. Progress. So the long-standing damage to these events, and even among all of us here present, we know that maybe 30% of people who have experienced this in their past. It's a silent epidemic. If you had 30% of people dying of heart attacks on the streets, the population would surely mobilize, and you would do something about it. But this somehow is still a taboo subject, as others in our society have been from time to time, whether it was tuberculosis at some point or being gay in more recent times. You need to do something about this. You're leaders in so many places, in so many areas in this institution. You could easily become leaders in this as well. And I don't see anybody in Canada taking this on. And it's a really important subject. So the development of children is another issue that is not really addressed in any of the organizational plans, and it's very important because development is damaged when children live in toxic, stressful situations, either in environment or socially. The reason this happens is because there's an increased circulation of cortisone, which on a perpetual basis. It's not just short when you have a stress and then it's gone, but it stays. It is responsible for reducing the synaptic connections in the brain. It ends up causing a smaller brain, a brain that can't function properly, a brain that is hyperactive, that can't pay attention, and that can't think. And this is mostly not very correctable. It leads to cardiovascular disease, diabetes, and so on, all chronic conditions in adults. More troublesome has been discovered in recent understanding of epigenetic processes, that it can damage the expression of the DNA in children and later in adults, and we do not know yet to what extent that is reversible. So it's a very serious thing to be aware of, and to try to reduce the opportunity, to try to reduce the situation that arises in environment or socially that inhibits the development of children. The determinants of health are the mirror image of the rights of children, the Declaration of the Rights of Children, which Canada signed in December 1991, but we have not done a very good job at respecting them. I'm not going to go through this. There are references. I've left references behind, but you should consider making Sudbury a child-friendly city. The UNICEF website will tell you how to do this. It's actually a fun thing to do. You need to do more for parks, more for bicycle paths, more for favoring activity for children. I don't know what the situation here is with schools, but most schools have gyms. Are they open on the weekend? Are they open in the summer? It's a public property. It should be available to children so that they can exercise, so that they can do other things and go to malls and get into trouble because they need to do something. So municipalities play a big role in this. Governments play a role. Schools with the gyms. Hospitals can provide leadership and knowledge. One of the things that can be done, and we've done in parts of Montreal, is that in front of all the municipal buildings there's a weather-resistant panel describing one right. So the schools are now doing tours of the rights of children in Hochelaga Maisonneuve, of all places, to learn about the rights of children. And these panels are in front of schools, in front of clinics, in front of municipal buildings, in front of anything that is a public building. There is one right described. And that helps to bring these rights to the awareness of the population. Childhood is entitled to special care and assistance. It should have first call on all resources, especially in bad times. Canada signed this declaration in 1991. You have inspired and inspiring leaders in this institution that can lead this thing, and you can make partnerships
Would
work.
the owner of the following vehicle parked in the South Tower on-call parking area? A gray Sebring bearing license plate BWAT 066. Please remove your vehicle immediately.
Okay. You've created great partnerships, and you can make those partnerships work and develop them and other ones towards this goal of raising the profile of child rights. I did not know this person, but some of you do, because I don't follow basketball at all, but there's a guy called Tupac Shakur, who's supposedly a big basketball star at the NBA in the United States, but he also writes some poetry on the side, which is interesting. He wrote this like a haiku. He says, "You see, you wouldn't ask why the rose that grew from concrete had damaged petals." Thank you.